what I wanted to create and aspire to do within MedCurate is take the control away from the agency and put it into the hands of those actually providing care, which are the clinicians and the organizations. And so in building this open marketplace, a healthcare organization like a hospital or a surgery center can post their need. They set the rate versus the agency.
Oh, wow. Yes.
Which is a game changer. And then the clinician sees that directly in the opportunity, provided that their licensure, competency, and credentials meet those requirements. And so we get the agency out of the middle and directly connect them as a conduit versus a wedge, facilitating that connection between both sides of the marketplace and a faster ability to pick up shifts.
Hello and welcome to the Counterweight podcast. My name is Doug Rogers, the founder and host, and we are in partnership with Digital Health KC, and we are doing a special series focused on digital health founders here in Kansas City as a lead into the Digital Health KC Day on August 19th and 20th. And I am extremely pleased to be here with Ashley McClellan, who is the CEO and founder, among other things, by the way, we're going to get into this, but CEO and founder of MedCurate. Ashley is an accomplished healthcare system professional and has had a tremendous career in the health system space. 3-time CEO, is a leader of teams, has built teams, has led through any number of challenges and opportunities. But Ashley, I think what we're going to hear is one of the biggest opportunities and challenges that you're now leading through is starting something.
Yes.
And building it from the ground up. So Ashley, I want to welcome you to the Counterweight. Why don't we take a moment and tell us a little bit about what MedCurate is and how you got started?
Thank you so much for having me. So you shared a little bit about my background, and as a CEO of a healthcare organization, specifically during the pandemic, I experienced the impossible dilemma of patients in our community needing our care, yet maybe not having enough people to care for them safely. And so whether it was a rural hospital trying to send us a heart attack patient or a COVID patient in our own ER, we didn't have enough staff to care for them or accept all the transfers that were being requested. And so that led me to this pivotal moment to decide there has to be a better way to approach supplemental staffing. So I left my 18 years of being a hospital CEO and was very fortunate to have those opportunities, but to do something about it so no one has to choose who gets to receive care based on staffing. So MedCurate is a two-sided marketplace.
Okay.
We connect healthcare organizations and healthcare providers looking to fill extra shifts without the traditional staffing agency in the middle. So think Uber, but healthcare staffing.
That's phenomenal. So I will tell you, we've all had experiences with healthcare, and I've been on a healthcare journey myself, and I walk into the hospital and I just expect that there are wonderful nurses that are going to be there, that are supporting, that are guiding me through the process. But what I hear from you is there is a ton of friction, challenge, and complexity behind the scenes to make sure all of those people, especially the nurses, are staffed appropriately, are in the right spot, and have the right skills for what needs to be done in those organizations. I don't know that people really appreciate how hard that is. As you started MedCurate, certainly you were on the front lines as a health system leader, as a CEO. It's not that there weren't solutions for this, right? There are, I think, agencies, right, that do this quite a bit. They help connect people. What sets MedCurate apart, and why is this different than what a hospital would normally do, if you will, to try to staff these types of roles?
Yeah, great question. So typically health systems staff based on historical volume data.
Okay.
So they know certain times.
Which that was a big problem in COVID because there was no historical.
Yeah, exactly.
That's right. Yes.
So as hard as they try to anticipate what may be coming in the door, at a hospital, you can't close your emergency department. There are federal regulations that you have to provide emergency medical treatment, et cetera, and accept patients. And so despite planning based on historical volume, there are fluctuations, and specifically during the pandemic.
Yeah.
And so the question became, okay, these patients continue to come seeking care because they need it. Our clinicians already have a full workload or assignment of patients. So do we try and stretch them further, which, by the way, they're already feeling that friction and burnout, and they're doing their very best work? Or do we look for additional resources to come to the organization to help with that? And historically, the only option for that has been to go to a traditional staffing agency. So in that model, a traditional staffing agency employs a pool of clinicians.
Okay.
And then say, Doug, you needed an extra ICU nurse tonight. You would call the staffing agency and say, I need another ICU nurse tonight. And historically, that staffing agency would say, okay, if you want that, Doug, this is what you're going to pay. And they'll give you a bill rate. But you don't know if...
So they have a lot of leverage.
Yes.
Yes.
They hold the control in the middle.
Right.
So they're really a wedge historically between the two sides of the marketplace.
And when you say they, you mean the agency, not the actual person providing value, which is the nurse.
Yes, exactly. So what I wanted to create and aspire to do within MedCurate is take the control away from the agency and put it into the hands of those actually providing care, which are the clinicians and the organizations. And so in building this open marketplace, a healthcare organization like a hospital or a surgery center can post their need. They set the rate versus the agency.
Oh, wow. Yes.
Which is a game changer. And then the clinician sees that directly in the opportunity, provided that their licensure, competency, and credentials meet those requirements. And so we get the agency out of the middle and directly connect them as a conduit versus a wedge, facilitating that connection between both sides of the marketplace and a faster ability to pick up shifts.
And so as you look at the market that you serve, so certainly I imagine this friction and challenge exists across every health system. But I would guess, and guide me, your large health systems probably have some other side of leverage with an agency in terms of the number of positions they're staffing, et cetera. But a smaller institution may not. And I imagine, I would guess that staffing and trying to fill these open positions is costly, time consuming, impacts patient care. When you go through a normal piece, is that part of what you've seen with MedCurate, is that you're able to kind of close that gap, especially for mid to small facilities?
Yeah, I call it speed to value. We want to be able to launch with our partners as soon as possible and have them see that value immediately. So our product works for any size of healthcare organization. However, we started intentionally in the rural communities. Our first partner was Golden Valley Memorial Healthcare, who spoke at Digital Health KC Day last year. And we chose that because, one, we're trying to balance both sides of the marketplace. So we wouldn't be able to source the supply of clinicians for a national health system day one, right? And so we work with the healthcare organizations to understand the demand and then go source that need. And it's really remarkable. The rural and community sites maybe don't have as much attention from the national staffing agencies because of that demand is less. For us, that's a great place for us to start and support them. And those communities feel that much more. So having an extra 1 to 4 nurses at a community or rural hospital completely opens up care for that community versus having 1 or 4 in a large academic medical center is helpful, but maybe not as transformational as it is in those rural and community hospitals.
That's right. Well, and to your point, it may be that for the agency side, it's not as many opportunities in these rural communities, but for the rural community and for the hospital, the need to staff 1 to 4 is exponentially more impactful than what that same number may feel at a larger health system. Not to take away from obviously what's needed in the larger health system. Now, some of the other things I've heard you talk about, it's not just simply the two-sided marketplace. There is both a satisfaction and a value savings that I think that MedCurate is impacting for these organizations. Could you talk about the financial impact that this delivers for a health system?
Yeah, glad to do so. So I wanted to create a system where everyone won.
Right.
And so on the healthcare organization side, they get to post their exact needs. So they're not locked into long-term contracts when maybe they have a shorter duration or shift-by-shift need. And they set their rate and then their service fee. So the average markup in the state of Missouri of what's paid to a clinician versus what's charged to the facility is 108%. It's
Really?
publicly reported through
Yeah.
the Department of Health and Human Services in the state. And so our service fee model is 25 to 30%, which is obviously significant
Right.
savings. So we're told from the healthcare organizations that they're saving at least $15 an hour for a nurse. And for an FTE on an annual basis, that's over $31,000. At the same time, the clinician is getting about a 20% increase in their hourly rate.
Wow.
So again, because we don't have that high
Yeah.
administrative overhead cost, it's highly functional through the technology itself. And we hear from the clinicians, they like working on the platform because they choose when and where they work and for how much, and pay is initiated within 72 hours of shift completion.
72 hours. That's phenomenal. And
Yes.
to your point around the cost savings, I mean, there's so many macro trends right now that are impacting health systems, healthcare. But one of the two big trends is certainly both the continual labor challenge, and labor is one of the largest expenses for any hospital, whether it's big,
85% of the operating costs.
85%. I mean, that a huge amount
Yes.
of the budget. And I imagine a pretty decent percentage of that actually goes to the staffing, or what I would call temporary or staffing in this type of model. At the same time, every single health system is being impacted by the lower reimbursement rates, the Medicaid redetermination, which is going to reduce, wrong or right, is going to reduce the amount of people who have insurance that get paid for when they receive care, which is going to cut into the funds they have to then actually staff people. So this is going to be front and center for every single hospital administrator over the next 12 months, I have to imagine.
Well, it is. And even before the pandemic and some of the different pressures we have today, I mean, whether I was at a nonprofit or for-profit or pediatric hospital or adult, it's always been the number one challenge. Healthcare leaders spend 60% of their time just trying to staff
Wow.
their department.
I don't know that I would realize that. I mean, that just blows me away that it consumes that much of both time and expense. Well, I will say some of the best ideas are ideas that just seem blatantly obvious. And this feels like an idea that was blatantly obvious, but clearly not, because it was not necessarily that this platform or this type of capability existed at a large scale. It is one thing to be the leader of a large health system and then to look at a problem and say, oh, I think I can go fix that problem. It's another thing to step outside the comfort of a large system, a large structure, a large number of people supporting you, and go try to solve a problem on your own that obviously goes into a team. How did you do that?
Yeah, it's incredibly humbling, first and foremost. So, I saw this pressure point and pain point and knew something had to be done. I have a very supportive family. And so I started drawing out what it would look like. I had my first conversation with someone that's a part of the ecosystem here in town, Darcy Howe. And when you share your concept, it's like showing someone your newborn baby.
Yes.
Please tell me you like it.
It's a very intimate moment,
Yes,
isn't
it
it?
is.
Yes.
Yes. And at that moment, Darcy connected me with Maria Flynn, who was a part of Digital Health KC, now
Two
Patterson.
giants here in the Kansas City area, by the way. Yes.
And from there, they kept helping me expand and learn about the broader entrepreneur ecosystem and digital health ecosystem across the region. And so while I wasn't certain with every step, when you're working for a large corporation, you have access to subject matter experts in everything.
Everything,
So
yes.
if I wanted to know how to negotiate a contract with a large payer, I could call someone. If I wanted to know the latest protocol for sepsis, I had someone to reach out to. And so going from having, teams of thousands to a team of one, being a solopreneur and figuring out who can I reach out to learn and build this vision I have for MedCurate. So I call it, I went from being under an umbrella of one logo to an ecosystem of many logos that all want to collaborate.
That's phenomenal. And Ashley, I'm going to ask this question. I think I know the answer. You are not an engineer by background.
No.
You may or may not, I mean, in today's world, everybody's a vibe coder, but you may or may not know how to actually write code or build a software application. How did it, to your point, in the health system, you had people who did payroll, you had lawyers, you had clinicians, you had IT people. How did you find find partners to go build your idea into life in a framework that is able to then go deliver the success that is for the organizations you're supporting?
Yeah. So interesting. I found myself when I was in a corporate organization having all these ideas and always being curious. And I cite Ted Lasso. He says, be curious, not judgmental.
Right.
And so I was always asking, well, why do we do it this way? Can we do it better? And so as I started building out what MedCurate would look like and had these questions, I would reach out to the entrepreneur ecosystem asking, well, who did that for you? How did that work? What would you do differently? I plugged into the different programs that are offered, such as Pipeline Entrepreneurs, UMKC Digital Sandbox, et cetera, and started to kind of put bits and pieces together of the puzzle to really build out the infrastructure. I will say one of the best things that we did as a company was make a connection with another entrepreneur that had a similar concept.
Okay.
And we actually, I spoke about it a couple years ago at Digital Health KC. It's Molly O'Neill with Superb Shifts.
Yes.
And her platform supports nursing homes and senior living facilities with staff. And so in meeting her, we actually came to an agreement where we acquired a copy of their code at a point in time that we wholly own now. And then we tweaked it from there, because in a nursing home, there might be one or two roles they're sourcing for and one approver. In a hospital or national surgery center company, there's thousands.
Right.
So we were able to tweak from there. A lot of the initial resources I plugged in were based on her recommendations and who was already familiar with the concept and model, whether it was, banking or insurance. And she had several years ahead of me in the process to know what worked and what didn't. So Molly and I continue to meet every other week by choice and support each other as entrepreneurs.
That's great. I like to think of what you just described as these happy collisions. But I think, as I listen to your story and as we talk with any number of other founders, the reality of these collisions are not necessarily accidental. They are the culmination of grit, being willing to go out and ask and have these, intimate and to some degree scary conversations around this idea that you're bringing to life. And then the willingness of other people to help and make those connections. One of the things that we talk about quite a bit, both on the Counterweight and Digital Health KC, is that there's so much focus on people who build companies, et cetera, on the coast. And sometimes people forget the amount of innovation and activity that's happening here in the Midwest, here in Kansas City. Talk a little bit around what your experience has been building here. And you referenced Darcy, Maria, et cetera, what the community has meant to you in terms of bringing this idea to success.
Yeah. So I'm a native of Kansas City. I grew up here. I left and spent almost 20 years in Texas before coming back in 2019. And for me, during my time at Research Medical Center, we worked with a lot of the community hospitals where we would send specialists to their sites. And when they needed a higher level of care, they would come to the facility I was at. And so I knew the healthcare community in this region. I had also worked at a Kansas hospital as well. And so I knew some of the pain points already of those organizations and had existing relationships to start with in the Midwest, which I'm very proud of, starting in Kansas City region. So from there, that has scaled. We're now in 14 states and over 111 healthcare organizations.
Congratulations.
Thank you.
That's amazing. And I'm sorry, so 11 states and how many healthcare?
14 states and 111 healthcare organizations at the moment.
And when did you start MedCurate?
So I filed the company in July of 23, built the tech out the second half of 23, and then our first shift at Golden Valley was in February of 24.
So 3 years, 14 states, 1,100 organizations.
111.
111. 111
Yes,
organizations.
that's okay. I mean,
But
that would be
still,
amazing.
but 1,100 is coming
Yeah.
in the next 2 years.
Yeah.
I just know that. So,
Well, thank you.
but this
Yeah.
community has been very meaningful.
Well, the community is incredibly meaningful. There's so much tech talent, which I
Right.
think was the impetus of starting Digital Health KC. And they've been very helpful, regardless of the phase I've been in. When I had no idea how to pitch, I'm used to asking for money from a corporation, and I know
Right.
the algorithm and the pro forma they want to see. It's different when you're doing it for yourself and as a startup for potential investors, et cetera. So the community here has helped me, whether it was my first pitch through Digital Sandbox and providing training around that, or the Pulsinelli Equity Series, understanding the different options for raising capital, pipeline entrepreneurs and all of the modules that they provide around, customer segmentation, knowing your business operations, telling your story, et
Right.
cetera. So regardless of where I was in my journey and where I have been, they continue to support me. For example, Digital Health KC has an Accelerate grant
Right.
to help expand product lines and technology offerings. And we were fortunate to receive a grant from them.
Congratulations.
Thank you. That we're building out technology for right now.
And so what is that grant helping to fund? So I think you have a new feature, a new
Yes.
capability that's coming out.
Yes.
That is part of the no pun intended, the acceleration of
Yeah.
that. So what is this?
The pun should be intended. That's
Okay,
exactly
that's
the
right.
point,
The pun
right?
should be intended. That's right.
So when we launched MedCurate, we were sourcing any role that a healthcare organization needs that's credentialed through human resources,
Right.
whether it's a nurse, a surgical tech, sterile processing, medical assistant, et cetera, imaging. And when you are an entrepreneur in a startup phase, you want to stay focused on your core business offering and not get distracted or try to expand too
Which
fast.
is easy to say, hard to do.
Correct.
Yes.
And so early on, I started getting asked, can you help us with, CRNA coverage or hospitals coverage or emergency room coverage? And I said, not yet. But as we have gone into our evolution and that request keeps coming up from our existing healthcare organizations we
Right.
partner with, we thought it'd be a great time to launch that. So that's called MedCurate Locums. That's for physicians and advanced practitioners like a nurse practitioner or a
Right.
CRNA. Those individuals have a very different credentialing pathway than everyone else that works in a healthcare organization. So they go through a they go through a credentials committee, then med exec committee, and then board. And their credentialing steps look different than everyone else. And so building out the tech to facilitate gathering all those items and supporting the process of getting them launched and credentialed at healthcare organizations is MedCurate Locums.
And I think, as people outside look in at companies like MedCurate or other digital health startups, I think it's easy for someone to think, oh, there's a need. You just go build that product. But it takes time, it takes capital, it takes focus. And part of what I'm hearing is not just a community of people that help to guide you and provide advice and counsel, but also a community where there's ability to inject new capital to go faster is valuable to a founder and entrepreneur such as yourself.
It definitely is. And that Accelerate grant was a new offering based on feedback from the entrepreneur community saying, hey, the initial Digital Sandbox funds were helpful to get us going, but this is what we need to get to the next level. And so they heard that from the entrepreneurs across the region, and we're fortunate to be able to fund that, which I'm really grateful.
So the topic du jour, obviously across the industry, is artificial intelligence, and it impacts everyone, but especially in healthcare, there's a tremendous amount of focus and investment around how AI is impacting healthcare. Ashley, I just would be curious, really, two things from you. One, where do you see that advancing and accelerating how MedCurate provides the platform and the value that you do to your organizations? And then probably more broadly, what does this mean for nursing?
Yeah. So for MedCurate and for any company, I'm sure it's a part of their strategic roadmap. But for us, we've been able to accelerate the process of clinicians getting credentialed through the platform. So for example, we do reference checks on all of our clinicians.
Yeah.
And so historically, the process was a clinician would enter a name, a phone number, and an email for a direct supervisor for us to reach out to, times 2. And so our sourcing team and credentialing team would call and text and message and go back and forth
Oh, yeah.
multiple times.
Probably pretty intensive.
Yeah, time
Yes.
intensive, hard to get feedback
Yep.
sometimes. And so now we've built it into the technology where when a clinician inputs that reference information, it automatically sends a reference request asking certain questions to the individual that was listed through text and email. And then when that information is received back into our system, AI pre-reads it and gives us a heads up, is this a yay or nay? We always have a human
Yeah,
review it as well.
That's right.
But that saves us hours per clinician in joining the platform. So that's one small example of how
Right.
that's been helpful. On the other side, too, clinicians, again, historically have been employed by a healthcare organization or by an agency. And so our opportunity hasn't existed historically
Right.
to pick up one shift a month or 1 or 2 extra shifts a week. And so now we are using tools to get in front of passive candidates that are not actually going to
Oh,
job
yeah.
boards and looking for
Yeah.
jobs to serve up our opportunity. And that's all based on agentic AI and serving up those opportunities where those individuals are looking.
Well, that is so great to hear. Yeah, as we think about Digital Health Day that's coming up and the journey both you've been on and MedCurate has been on, I'm sure that there's been a lot of highs. I'm also sure that there's been some challenges, some days, some nights where you're like, how is this all going to work? How is this all going to come together? If there is a founder, and I know there will be, if there's a founder sitting in the room on August 20th and they're listening and they're trying to take some inspiration, what would you tell them to think about? And what would you tell them based on the journey to look past or embrace or learn from that has helped you deal with both the highs and the lows?
Yeah. So I would say there's no perfect time.
Yeah. Well, first of all, let's say that again.
Yes.
There's no perfect time.
There's no perfect time to
Yes.
take that leap of faith. You're never going to be perfectly confident, have all the resources and tools at your disposal to go and execute this vision
Yeah.
that you have. So what I would say is figure out who is going to be at your side within this entrepreneur ecosystem on that journey, because there are lots of highs and lows. You feel all of them because they're
Yeah.
yours.
They're
right?
yours. Yeah. Which once again, when you are within a system,
Yes.
there's still highs and lows, but those are shared.
Yes. And
Yes.
so it is an emotional journey, a
Yeah.
personal journey, not just a professional one. And so knowing how to navigate those, in a corporate setting, there are a multitude of dashboards and you're getting feedback on, okay, great, your length of stay is here. We need it here. You come back next week and you talk about that metric again and see if you've moved the needle. And people are saying, great job, or let's focus here. As an entrepreneur, no one is telling you, hey, that was a really great pitch that you did the other day, or I see you made a really strong connection with that clinician. And so you have to develop your own structure. We use EOS to hold ourselves accountable and to celebrate those milestones, because sometimes it's hard to feel a win when you're in the thick of it. So for someone considering it, I had this moment I have 2 teenage sons, and my 16-year-old, there were some different health system opportunities that were available or up for consideration. And I said, I love taking care of people, and I feel confident in my skill set doing that in a health system. And I may have the opportunity to do that again. But we were making all this progress with MedCurate. And Brooks looks at me and goes, Mom, you can go do that. You're qualified to do so. And you can help one community that way. Or you can continue your journey with MedCurate and bet on yourself to help hundreds and thousands of communities with what you're building. But it's up to you if you're scared.
Wow.
Yeah, leave it to your kids to keep it
Remarkable
real.
wisdom. That's
Yeah.
right. In a teenage body,
Yeah.
which is wonderful insight.
It is. And
yeah.
and sometimes it's hard to see it for yourself. I
That's
would say
right.
that's the other part that's been so heartwarming is
Yeah.
how supportive and encouraging the ecosystem is, even when I didn't know what was the next step,
Right.
or how am I going to get there, or when am I going to get there.
So as you look back over the last 3 years, is there any particular moment that just really stands out to you as, I can't believe that really happened?
Oh gosh. Well, our first shift,
Oh,
of course.
Yeah.
The first shift and first revenue is always very exciting. I think when we crossed the threshold of 100 healthcare organizations, That was really meaningful for our team, knowing that
Banners come out of the sky,
Yeah.
balloons are that's right.
Yeah. So it's just really exciting to know that we're able to expand our mission and that the feedback has been so positive on both sides of our partnerships. No, I think it was probably that pivotal moment with my son that really made me realize this is what I'm meant to do and I'm called to do. And I can do so much more to help people this way. And so that's why I'm so grateful for everyone that supported me and is helping me scale it to the next level.
Well, Ashley, certainly not just a remarkable journey, but a journey that continues without a doubt. And I would go back to the earlier statement that some of the best ideas feel like obvious ideas, but there's a reason why they don't come into creation until there's someone that has grit and tenacity and a willingness to jump into the unknown to make that idea a real thing. So kudos to what you're building with MedCurate. Last question I would have as we go into Digital Health Day, anything that you would suggest out to the audience that you would want them to experience when we are all together in the Abbott?
Yeah, I would say lean in. Get connected with those that are at the event. This is the ecosystem that wants to help support you and grow around innovation in our community. And so, meet with multiple people, sit with people you don't know already.
That's great advice. Yes.
And hear what they have to say and what are their pain points. If you're a founder or entrepreneur, it's not about selling your product. It's about hearing from potential customers what their needs are to make sure that you're actually meeting their needs and solving their pain points. And so you can have a lot of those conversations naturally and organically at Digital Health KC and then grow those relationships and nurture them as you continue to grow your new company and organization.
Ashley, I want to say thank you for joining the Counterweight podcast. And I would say to our audience, one, be on the lookout for Ashley. She will be at Digital Health Day. And one of the things that I've just learned in the short amount of time is how willingness she has been to help and provide advice in the same way that many people have helped her. And so please take the opportunity, introduce yourself, say hi. Ashley, congratulations on what you're building at MedCurate. This has been a wonderful conversation.
Thank you so much for having me, and thank you to Digital Health KC as well.
All right.